Hello everyone, welcome to LSTC. This is Bapi Sarkar. Hope you all are doing well. Extreme heat can affect anybody. Those most at risk are older people, young children and people with medical conditions. So guys, before dive into it, we will know what is heat stress. Heat stress occurs when our body is unable to cool itself enough to maintain a healthy temperature. Normally, the body cools itself by sweating, but sometimes sweating is not enough and the body temperature keeps rising. Heat stress can lead to heat exhaustion or heat stroke. Symptoms of heat exhaustion: headache, dizziness, lightheadedness, fainting, weakness and moist skin, mood change, irritability and confusion, nausea and vomiting, symptoms of heat stroke: dry, hot, no sweating, mental confusion, seizures, convulsions, preventing heat stress. So guys, to prevent the heat stress, we have to know signs, symptoms of heat related illnesses. Block out sun or other heat related sources. Use fan, AC units. In high heat, drink 1 cup of water every 15 minutes. Wear lightweight, light color, loose fitting clothes. Avoid alcohol, caffeinated drinks or heavy. Wear sunscreen of SPF 15 or reapply every 2 hours. So now we will know how to treat heat related illnesses. So guys, move workers to cool shade areas. Loosen or remove heavy clothing. Provide cool drinking water in small amount of every 2 to 3 minutes until the victim recovers. Fan and mist person with water. And ultimately, do not give ice to the victim. So guys, this is all that we have for today. If you find this video informative, do subscribe, like and share with your friends, colleagues and everyone who are interested in our professions. Thank you. Thanks a lot for watching.